Hello everyone, welcome back to my YouTube channel nursing.com. Today we are going to learn about malabsorption syndrome. तो चलिए शुरू करते हैं इंट्रोडक्शन से. Malabsorption syndrome is a group of disorders marked by subnormal absorption of dietary constituents and thus excessive loss of nutrients in the stools, which may be defect in digestion or a mucosal abnormality or lymphatic obstruction. It is characterized by the association of chronic diarrhea, abdominal distension, and failure to thrive. The clinical features develop due to poor absorption of nutrients in the small intestine, particularly absorption of fats. Poor absorption of other nutrients, including carbohydrates, minerals, and proteins may also occur. Causes in that gallbladder and pancreatic diseases, lymphatic obstruction, vascular impairment, and bowel resection. It is related to mild to moderate steatorrhea. Steatorrhea means presence of excessive fat in the stool. It may found in PEM. PEM means protein energy malnutrition, iron deficiency anemia, intestinal parasitosis. Severe steatorrhea is found due to cystic fibrosis, celiac disease, and tropical sprawl. It is rare digestive disease that affects the small intestine's ability to absorb nutrients. Clinical manifestations in that abdominal distension, failure to thrive, flatulence, anorexia, fatigue, loss of weight, malnutrition. Chronic diarrhea is presented as abnormal stools which continues or recurrently occurs over several months. Stools may be loose and bulky in celiac disease, pasty and yellowish in exocrine pancreatic insufficiency. It may be liquid as water and mistaken for urine in infants with congenital chloride diarrhea or passed with noise and flatus in case of sugar intolerance. Non-specific chronic diarrhea in toddler is presented as mucus containing foul-smelling stools. Malabsorption and chronic diarrhea is manifested in three major categories. First, impaired digestion. Second, intestinal malabsorption. Third, carbohydrate malabsorption. First, we will see impaired digestion. In that, impaired digestion due to exocrine pancreatic insufficiency also result in chronic diarrhea and malabsorption. It also occurs due to cystic fibrosis, lipase deficiency, bile duct atresia, and Crohn's disease. It is manifested as frequent loose pasty, greasy stools with undigested fat and offensive cheesy smell. Massive steatorrhea occurs most frequently in exocrine pancreatic insufficiency. Next is intestinal malabsorption. In that, intestinal malabsorption can presented with chronic diarrhea as loose or liquid stools, often with an acidic smell. These patients have steatorrhea, abnormal D-xylose test, and abnormal intestinal histology. This condition is usually associated with celiac disease, food protein sensitivity, giardiasis, immunodeficiency, trophical enteropathy, malnutrition, and bacterial overgrowth. Next is carbohydrate malabsorption. In that, carbohydrate malabsorption may be presented as chronic diarrhea due to fermentation. It occurs due to congenital deficiency of mucosal enzymes for digesting mono or disaccharides. It is presented with liquid, acidic loose stools which are usually passed with flatus. Volume of stools is variable. Investigations in that history of illness, exocrine pancreatic function test in steatorrhea, serology for celiac disease, lactose tolerance test, serum IgA, anti-gliadin antibodies represent reliable screening test for celiac disease. The diagnosis is confirmed by repeated routine stool examination, fecal fat studies, D-xylose test, intestinal biopsy, sweat chloride test for cystic fibrosis, breath analysis for carbohydrate malabsorption, barium meal study help to detect structural problems. Management of malabsorption syndrome. In that, promotion of adequate nutrition intake considering the specific defect. Symptomatic control of diarrhea is desirable. In celiac disease, a strict gluten-free diet is the cornerstone of the management. Rice and maize are non-toxic and act as wheat substitutes. In cystic fibrosis, the diet is introduced gradually with simple nutrients which are tolerated. Diet should be planned with food items rich in protein and sugar. Vegetable fats rich in polyunsaturated fatty acid are preferred to the animal fats. Pancreatic supplements, antacids, sodium bicarbonate, and antihistamine are essential. Suitable antibiotics, additional salt during summer months, and prostaglandin analog are used. Breathing exercise with chest physiotherapy are encouraged to prevent pulmonary complications. Gene therapy is now available for cystic fibrosis. Treatment of carbohydrate malabsorption consists of excluding glucose and galactose from diet. A period of intravenous nutrition is usually indicated in serious cases. Nursing management, in that the important assessment in that daily intake and output, daily weight, vital signs, serum electrolytes and GI functions are frequency and characteristics of stool which nursing management, in that the important assessment, daily intake and output, daily weight, vital signs, serum electrolytes and GI functions is frequency and characteristics of stool with other related clinical features. Nursing intervention should emphasize on improvement of nutritional status by appropriate diet planning and supplementation of deficient nutrients or substituting them, restoration of fluid and electrolyte balance by oral and parenteral therapy, continuous monitoring and recording of patient's condition, relief of pain by medications, Fowler position and comfort, analgesics, antiflatulence and antidiarrheal agents are administered as prescribed. Maintenance of skin integrity, especially of perineal area. Health education to the parents about general cleanliness, nutrition, hydration, danger signs, home care, and follow-up for necessary medical help. Relief of fear and anxiety about long-term illness and hospitalization by appropriate explanation, reassurance, and necessary support. Thanks for watching.